Well, March is Colorectal Cancer Awareness Month, and each year this form of cancer claims more than 50,000 lives. But regular screenings save countless more lives. Joining us now, Singing River Health System colon and rectal surgeon, Dr. Ramon Brown. Dr. Brown, thank you so much for joining us. And this is an important message. I think colon cancer numbers are pretty high in Mississippi, too. And this is something, I know you're a surgeon and we'll get to that part of it, but first of all, the prevention part of it and catching this early is so important, and colonoscopy continues to be the gold standard, and that's how you catch these cancer cases early, perhaps even before they start.
Correct. And thanks for having me this afternoon. So colon cancer is preventable to a certain degree. A lot goes into how colon cancer forms. Some of it can be genetic, some of it is environmental exposure, and some of it is what we're consuming, what we're eating. Colon cancer is a very sneaky disease. A lot of times by the time we know about it, it's only in retrospect that vague abdominal pain, changes in bowel habits like constipation or diarrhea are really kind of the harbingers of something that we didn't expect to find. So really the best way to do this is early detection with screening. And notice I didn't say colonoscopy only, because we've shown that colonoscopy only screening methods kind of reduce the overall capabilities of screening. So being open to other methods is really important as well.
Is the other main method you send in a sample?
Right, and so stool testing, either with fecal occult stool testings or with tests that now analyze the DNA that's shed into the stool is the way to go. The official name of that is Cologuard. That's the test that is going around right now. At the end of the day, though, if those tests are positive, you may need a colonoscopy regardless in order to find and potentially remove polyps, or which are the abnormal premalignant growths that eventually become colon cancer, or to biopsy and find the cancers.
Sure, that way that helps you when if you should need to do surgery, right?
Right. And it helps the patients really, because colonoscopy has been shown to be the only screening test that actually prevents cancer. It's part of the reason why for the last 2 or 3 decades we've seen a decrease in the incidence of colon cancer. But we're trying to increase our screening rates. I think Mississippi's screening rate right now is about 64%. And the goal ultimately is to get to at least an 80% screening rate across the country.
And how successful are treatments now? I know it depends on the stage of the cancer and a variety of other issues, but have we seen a lot of improvements there as well, since that's your specialty?
Yes, and so once the cancer is detected, patients who don't have metastatic disease have really good survival rates, out to 5 years, greater than 80%. Those patients who do have metastatic disease, depending on how far it's progressed, stand a chance of a good overall survival as well. But the key is to try and catch it before it gets that far. It's part of the reason why we've shifted the age on screening from 50 to 45. This was something that was recommended, I believe, back in 2020, and it's eventually taken up in 2021. We've seen, and we, the medical community, have seen more and more patients developing colon cancer at earlier ages. So it's felt that moving the age down to 45 would allow us to catch more patients earlier who may have colon cancer.
Right.
Or
yeah.
Move with polyps.
Definitely glad you mentioned that, and I don't want to let you get away without telling people about a couple of events coming up where they can ask all the questions they want to about colon cancer and learn more. There's even going to be a mega colon that people can take a look at. This is going to be in Gulfport, I believe, on March 11th at Singing River Gulfport, and then March 15th in Pascagoula, right?
Correct, and I'll be speaking at both of them, so if anyone has any specific questions that they like me to answer, or Dr. Plott or Dr. Rinker, who will also be at those events, we'll be there to lunch and learn.
All right, the lunch and learn, that's great. All right, thank you so much for joining us today. Great information.
Thank you very much for having me.